Duval County Public Schools is working to increase access for students to mental health resources. Katrina Taylor is the Director of School Behavioral Health for the Duval County School District and is joining us this morning on The Morning Show. Good morning. Thanks for being with us.
Thank you for having me.
So the district has fantastic resources, and I think a lot of times the students and parents are just unaware that they even exist. Let me start, though, if we could. Let's talk a little bit about what you are seeing in schools with teens. What are the biggest concerns that mental health counselors are seeing with them?
Well, because of the pandemic, we see adjustment, students trying to adjust to normalcy of coming back into the schools after being away in their homes for a number of months. We see that a lot at the elementary level. At the secondary level, we see some students that are really dealing with anxiety. A lot of anxiety, as well as depression. Our students have dealt with some grief over the past 2 years, so trying to adjust to normalcy is what we're seeing with our students. Also trauma. Trauma is a big one within our community and within our city, within this nation. So those are the issues that we're seeing primarily with our school-age children.
And do you find that, I remember in the height of the pandemic, we were in communication with Wilson Children's Hospital, Baptist Health as well, saying, look, we have got a dramatic increase in the number of teens in particular who need immediate emergency mental health care. That trickles down to the schools regardless of the age. What are the triggers here? Is it mostly associated then with the pandemic and isolation?
Absolutely. Like I said, the students had to adjust. This is the first time that we've all gone through a global pandemic, and we had to adjust. So imagine a student from the age of 5 to 18 trying to adjust to the normalcy, something that was their new normal now, dealing with that. In the school system, we have seen an increase in mental health referrals. Some of our schools that were not at capacity in previous years, after the pandemic, they are at capacity. We have more students that are being referred for mental health counseling, and so we have seen what a impact that this pandemic has had on our schools and students' mental health.
And it is so hard to just get teens to even communicate sometimes these days, you know. It's hard to get them to really just talk about how they're feeling and recognizing then that those might be signs that they need some outside help. So let's talk a little bit about the new initiatives this year, including something called the Clothesline Project?
Yes, so we got this project from China, and over there they did a clothesline project in their schools. So all the students were involved where they brought new or used t-shirts that may have had something on them. They turned them inside out. And the whole goal was that everyone in the school would write a positive, uplifting message. So when you walked into that school, you saw this message of never give up. Your mental health matters. You are loved. So the students were encouraged as a result of those t-shirts being, in the buildings as they walked into their schools. So our goal is to ensure that our schools partake in this project, and so we can have that same positivity throughout the month of May, but also as they're testing this month, they'll be encouraged to keep going.
And sometimes it's knowing that it's an issue, and then it makes it a little easier to talk about it, and you're not as hesitant. So the GROW initiative was launched this year also after feedback from students. How does that work?
So the GROW project came as a result of an intern that we had in our communications department, but she really had an interest in mental health. And so she had an interest to state that I'm going to go into schools and develop these focus groups of high school students, because I myself had some mental health concerns when she attended Riverside High School. And so she developed these focus groups with these students and received their impact, their input from those focus groups. And with that came the GROW initiative, which stands for Gain Resilience, Obtain Wellness. And so through that, we're normalizing mental health. The students have a place where they can talk about it and break the stigma. We understand the importance of the youth voice. As adults, we may see things one way, but students see it as a totally different way. So getting that youth input and the youth voice, that allows us to be receptive to what they're talking about. So in 14 of our high schools, we have GROW clubs, which are funded by our Baptist and United Way of Northeast Florida partner. And these students have these GROW meetings where they raise awareness as it relates to mental health. They also bring about what access is available for our students in our schools. So the whole point around the GROW clubs and the GROW team and the GROW initiative is the youth voice, which is also powerful.
So much of helping them is listening to them to begin with. Katrina, thank you for your time this morning. We appreciate it.
Thank you for the opportunity.